Good afternoon, everyone. Today's session is going to be really helpful and it's led by Dr. Latika Uppal from Apollo Cradle and Children's Hospital. She is going to talk about care of a preterm baby. So stick around until the end and ask us questions if you have any. Doctor, you have the stage.
Hi, good afternoon. I'm Dr. Latika Uppal. I'm Senior Consultant, Neonatology and Pediatrics at Apollo Cradle, Amritsar. So today we'll hit upon the topic care of a preterm baby. Now, preterm birth, as it is associated with a lot of anxiety. People have a lot of doubts. आगे जाके बच्चा कैसा रहेगा? What are the complications that are associated with prematurity? In most cases, it is associated with the NICU stay. निको में बच्चे रहते हैं. So that also causes a lot of financial, emotional anxiety to the parents, as well as separation anxiety, because based on the gestation and the weight of the baby, NICU care is required. So, how do you take care of your baby once you won this battle and your baby has become a NICU warrior? What are the take home messages? So, it starts with the once you take your baby home, there are a couple of things that you need to keep in mind. We'll start with temperature control and clothing of the baby. So the temperature has to be maintained between 24 to 26 degrees Celsius. Layering of the baby has to be adequate. Overclothing and underclothing both have to be avoided. So it is very essential that a baby wears cap, socks and mittens, because majority जो heat loss रहता है वो सिर से रहता है. It is through the head because of the larger surface area compared to the rest of the body. So it is important that you keep the baby adequately covered. There should be, depending on the weather, the thumb rule is generally dress them up, make them wear a layer more than what you're wearing. So suppose in these winters, if you feel the need to wear 2 sweaters, the baby will wear 3. Commonly, it is seen that over bundling or over wrapping is practiced. So that causes sudden rise in temperature in common language called fever. Because baby, the temperature center is not that mature, the brain is not mature. So thermostat regulation utna nahi ho pata hai. So adequate clothing is very important. Make sure they are comfortable. If you feel, despite clothing the baby, that there are any signs or any cues that the baby is giving you, baby's uncomfortable or the extremities are turning blue or is too sweaty. So these are cues where you need to either add or either remove a clothing. Second and most important is kangaroo mother care. So babies with low birth weight, babies who are premature, 32 weeks and below, normally in usual cases, and 1.8 kgs and below, usually kangaroo mother care is advised. However, KMC can also be done for an older baby with low birth weight, that intrauterine growth retardation, or any baby who has had a prolonged NICU stay. So in this, the baby is placed in the center of the mother's breast. The face and the ear touches the chest of the mother, and with the mother's breathing, the baby's breathing gets stimulated. So this offers a world of benefits. First and foremost, it's mother and infant bonding. Secondly, it enhances, because of the touch and the maternal mother and child contact, it increases the milk flow in the mother. So it stimulates the feed production. Along with this, it also provides ambient warmth and heat to the baby, because mother's body temperature maintains the temperature of the baby's body. It also helps stimulate sensory development and neurocognitive development in the baby. So that means enhanced achieving of milestones at the correct time. It helps in weight gain. It also prevents apnea. Now, apnea is sudden cessation of breathing. These babies, the premature babies, depending on their gestation age, they at times forget to breathe. So you need to remind them. So they require stimuli for the same. Stimuli can be by tickling behind the ears, rubbing the foreheads, flickering on the feet, or generally rubbing the baby's back. So KMC is a very effective way of giving continuous stimuli without disturbing the baby. So with the mother's breathing, the baby's breathing keeps getting enhanced and the babies thrive. So kangaroo mother care is a very important aspect. It is very important that the sessions should be as long as possible. There is no point providing KMC for 15, 20 minutes, and then because this in and out transition itself causes the babies to get fatigued. So at least 1 to 2 hours, and preferably as long as you can, KMC sessions should be done. Now, kangaroo mother care can be done by any individual in the family. It may not necessarily be the mother, grandmother, maternal aunts, even fathers, but for that, the chest hair has to be removed, and proper hygiene has to be maintained. So, kangaroo mother care can be practiced by anybody at home. Now, third and most important aspect, what are the danger signs and symptoms? What do you look for when you take the baby home? So you have to see how the baby is breathing, whether the baby is breathing too fast. Do you see any nose flaring, movement of the nostrils? Can you see the ribs going in and out? Can you see the chest movement being unusual, either too less or more? So the normal breath rate of a baby is 40 to 60 per minute. You have to look out for any kind of bradypnea, that is, less breathing or fast breathing, and that's a danger sign. You also have to look for any form of cyanosis. Cyanosis is turning blue. It can be the lips, the mucosa of the mouth, the earlobes, the fingernails of the hands or the feet. So this is something that you need to look out for. In case there are any such danger signs, or do you notice any kind of abnormal movements? Abnormal movements can be cyclical movements, repetitive, one form of movement that they are repeating for a long time, and it doesn't it doesn't stop with any kind of stimuli. So that is abnormal jerky movement. Any uprolling of the eyes, which is persistent, any unusual high pitched cry, or the baby seems in any kind of distress to you. So these are danger signs which require an emergency visit. Now, feeding. Feeding is another very important aspect. Usually, based on the weight and the gestation of the baby, initially tube feedings are given, orogastric or nasogastric feeds, and they are gradually built up. Once the baby attains 32 to 34 weeks, non-nutritive sucking is started at an early gestation, and once the baby attains 32 to 34 weeks, we try palade or katori chammach feeds for the baby. We may also, some babies have an early and strong suck reflex, so direct breastfeeding can be initiated. So based on the baby's readiness and development, feeding is important. You have to make sure that you try and give as much as mother feed as possible. Now, every mother's feed is tailor made for her own baby. The composition of premature mother milk is different from that of a full term mother feed. So, the mother feed of a preterm baby is apt and ambient for that baby's requirements and caloric needs, as well as vitamins and minerals. It's important that you give katori chammach feeds and breastfeed. Bottles are something that we do not recommend because that leads to nipple confusion. So you may notice that you have introduced bottles early to the baby, and now the baby is being fussy or cranky while breastfeeding, or is refusing to breastfeed, or sucks for a while and then suddenly starts crying. But when you offer the bottle, the baby is taking it normally. So this is known as, these are signs of nipple confusion. Bottle feeding is associated with a host of respiratory as well as gastrointestinal infections, because adequate sterilization is very, very important. So preferably give mother feed. If formula feed or top feed is needed, you can either use donor breast milk, pooled breast milk, or nowadays sachets are available, or you can give preterm formula. So it is important to give as much as feed as the baby wants to take. There is no upper limit that, sometimes parents go home with a thought that it is, we just need to give 30 ml feed. No, it is not like that. You regulate your own hunger. Similarly, it's for a baby. Now, what is important is the feeding gap. These babies usually do not demand early. So, parents usually go under the impression that जब बच्चा भूखा होगा वो अपने आप उठेगा. No, it is not like that. It is important to either breastfeed or formula feed the baby every 2 to 3 hourly. You have to wake the baby up. Now, during feeding, continuous stimulation is very important. So you can keep flickering the soles gently, or rub behind the ears, or stimulate the face and the forehead. So these are things where continuous stimuli encourages the babies to continuously feed. Otherwise, usually what happens is that they suck, they take a few sips, and then they tend to sleep off. Sometimes you may notice that the baby is taking feeds very, very randomly and quickly, say every 20 to 30 minutes, or for a long time, breastfeeding for an hour or so. And this may continue for 4 to 5 hours, which is followed by a gap of, say, 4 to 5 hours again. The baby refuses to take feed. So do not panic. That is known as cluster feeding. Cluster feeding is normal. Now, this thumb rule that you have to wake the baby and feed is applicable both day and night. It's not like that you have to make the baby sleep throughout the night. So, you need to wake and feed the baby at regular intervals in order to prevent hypoglycemia. Otherwise, their blood sugars fall very rapidly. Now, the next thing, which is very important, is pumping. Sometimes babies are unable to suckle or unable to latch. In that case, what can you do? So it's important to buy a good quality or good company breast pump, preferably a hospital grade pump. There are many available on the internet. So you can use the pump to express your feed. Stored breast milk can be offered to the baby at a temperature of 24 to 26 degrees over the next 4 to 6 hours. You can also store it in the fridge for the next 5 days, not in the freezer. In the freezer, you can make packets and deep freeze breast milk, which you can, use for months, even years at times. Once you take the milk out of the refrigerator, you have to place that bottle in warm water. आप एक कटोरी में पानी गर्म करके बॉटल को रख सकते हैं, or you can use bottle warmers. So once the ambient temperature is reached, you can offer that milk to the baby. Once you heat a mother's feed, you cannot restore it in the fridge. You can use it over the next 4 to 6 hours. Bottle warmers is something where at times hotspots can occur. That means कि दूध कई जगह ज़्यादा गर्म है, कई areas में ज़्यादा ठंडा है. So that may cause the tongue of the baby to burn. So you have to be a little careful about that. Now comes blood investigations. So your doctor may suggest a couple of investigations like newborn screening, thyroid profile, complete blood count to keep looking for anemia of prematurity. So it is also very important that your baby receives a hearing test as well as eye screening, retinopathy of prematurity test, which is done by ophthalmologists. It is important that you visit your ophthalmologist, your and get your hearing test done, and do not ignore these tests, because these can lead to blindness. ROP can lead to blindness. It's a preventable condition where correct intervention at the correct time helps protect the eyesight of the baby. Now, coming to the supplements. There are a plethora of supplements that may be offered to your preterm newborn baby. As I mentioned before, there's something known as apnea, where they forget to breathe. So, medicine may be given to the baby in order for the baby to remember that he has to breathe. And this is continued till a particular gestation, till a particular level of maturity is reached. There are a couple of supplements which may be prescribed for your baby. First and foremost is vitamin D. It is very important because you see, most of the transfer of the vitamins and minerals takes place around 36 weeks and above. So, any baby who's born before that gestational age is required supplementation. Nowadays, vitamin D is recommended for all term babies as well. Next is multivitamins. So, multivitamin drop may be prescribed to your baby for a period of 6 months to 1 year. Then comes MCT oils, medium chain triglycerides. They are usually prescribed for better development and weight gain of the baby. They can be added to mother feed, express mother feed, as well as formula. Pre and probiotics. There are certain mothers who may be unable to breastfeed, or the milk supply is not that adequate and are more dependent on formula feeding. So, in order for the gut to mature, pre and probiotic sachets or drops may be suggested for your baby depending on the condition at the time of discharge. Then comes iron. Iron is usually started around 4 to 6 weeks for a preterm baby, because their bone marrow usually is not able to produce, is not that active enough, and they tend to have anemia of prematurity. So, iron fortification helps to prevent that, and it may be suggested to your preterm baby depending on his or her condition. Human milk fortifier. These are sachets which are added to enhance the quality of the expressed mother milk. So, your doctor may suggest, may prescribe you human milk fortifiers that you can add to your milk to enhance its properties, and that may be given to the baby. Now, protect your baby's health. It is very important that you limit visitors and you limit outings, especially in this season. This is RSV, flu season, COVID cases are rising. So, it is very important that to stay away from the premature baby, because their immunity levels are very low. They develop very quickly, and most of these are droplets. Now, by coughing and sneezing, you can spread the germs through the air and can infect your baby. So, yeah. So, it's also important that you practice proper hand washing and sanitization. So, Am I audible? All right. I think there was some disturbance. Sorry about that. It is very important that you maintain adequate sanitization. There is no need to keep washing the baby's clothes in fancy detergents and Dettol. It's just important that you either sponge or preferably bathe the baby, if not every day, then every alternate day. And the care providers or handlers should have trimmed nails, their hands and the jewelry and artifacts should be avoided because they carry germs and they are a source of infection. Avoid wearing perfumes, lipsticks, things like that. There are many mothers who ask, can we go for keratin or bond treatments and things? So, a lot of treatments and stuff you need to avoid because most of these products are excreted or secreted through the breast milk. It is also very important to let your doctor know if you yourself are on any medication. There are a couple of medications which are not compatible with breastfeeding, and during that time, you may be asked to provide alternate feeds to the baby and not give your own direct feed. Next is well baby checkups. It is very, very important that you bring your baby to your pediatrician or neonatologist for regular follow ups. So, these well baby checkups is when we determine whether there is any faltering in the growth. Is the baby gaining weight adequately or not? Is there any developmental delay? Is the baby like a normal baby? Is there any issue with the vision, hearing, or feeding? So, well baby checkups are very important. Usually, after discharge, you're called within 2 to 4 days of the discharge. We also keep checking for jaundice because in preterm babies, as it is in babies, the red blood cells lifespan is shorter compared to adults. The blood lysis is faster, so leads to jaundice more. And in premature babies, it is more common. A way of prevention is sunlight, adequate sunlight or natural light exposure for at least 20-30 minutes to an hour a day. So, your regular baby checkups, we discuss your anxiety, your issues related to the baby, any growth issues, any faltering in the milestones. So, it is important that you turn up for your well baby checkups whenever asked. Next is vaccination. It is very important to have vaccines done at the right time and not miss the vaccines. There are a plethora of vaccines now which are available in the Indian market. In fact, we are one of the few countries which has a very extensive immunization schedule. So it is very important to not miss these vaccines because they offer protection against deadly diseases, especially vaccines like pneumococcal, flu, MMR. They offer protection against respiratory diseases, COVID, and a lot other. There are a lot of dangerous diseases. So your vaccination is your best bet. It's important that you get it done at the right time. Brands are available, prices you need to discuss with your neonatologist or your pediatrician which brand has better benefits or is suited more for your baby. Next comes developmental delays. So there are a couple of milestones which are age appropriate, and these are discussed with your newborn specialist or pediatrician at the time of regular well baby checkups. When will my baby start looking at me? When will my baby have a social smile? When will he or she control his neck? My baby is not sitting. So there are stages, and we keep looking for red flags. So if your baby is not sitting by, say, 8 to 9 months, it's a red flag. We keep assessing the development at every well baby checkup. The other important thing is sudden infant death syndrome. It is important that in your baby's crib, there are no soft toys, over blankets, and over clothing. And it's important that you Change the position of the head with every time the baby sleeps. Otherwise, it can cause flattening at one side. We normally suggest that you make your baby lie on your back, face up, so that prevents SIDS. Because these babies, and in prematurity, it's more common, they regurgitate feeds. That's known as gastroesophageal reflux. After every feed, they may take out some feed from their nose and their mouth, and at times it can enter the airway. So you have to be a little vigilant. Now, most important aspect of this entire session is maternal depression, postpartum depression. It is very important that you take care of your own self. Uh, the premature deliveries and NICU stay take a toll on the maternal health as well. Am I doing enough? Am I good enough? Is my baby, fine? Will something happen to the baby? Did I do something wrong? So things like these you need to take care of. It's better to join a support group, uh, take adequate counseling sessions where required, speak to your gynecologist or your neonatologist if you have any apprehensions pertaining to feeding or handling of the baby. It is also important that you maintain adequate breast milk supply, drink plenty of water. There are a lot of galactagogues which are available in regular diet. Consume good amount of protein, fish, eggs, chicken. For vegetarians, tofu, soy, moong ki dal, then jeera, saunf, garlic. These enhance the feed. Shatavari good. There are a lot of supplements which are available in the market to enhance the quality of your feed. Now, it is very important for you to know that drinking water increases the milk supply. So you need to drink adequate amount of water, at least 2 to 3 liters, for you to maintain a good milk supply. It's also important to pump or breastfeed at regular intervals in order for the milk supply to maintain. If you cut short, or you're feeding like breakfast, lunch, dinner, your milk supply goes automatically down. Also, it is very important to have at least two breastfeeding or pumping sessions between 12 to 5 a.m. because the prolactin hormone is at its peak during that time. Accept help. It is very important to accept help and support from your family, friends, maids, however, whatever floats your boat. So, maternal, mental, and physical well being is of equal importance. Keep a journal wherein you keep writing whatever are your anxieties or whatever issues or whatever doubts you're facing regarding the baby's growth and development. The last and the most important take home message is never, ever, ever compare your baby with somebody else's baby. No two humans are the same. No two cases are the same. मेरी फ्रेंड का बच्चा इस टाइम पर हुआ था, उसका ऐसा हुआ, मेरा ऐसा नहीं हुआ, मेरा बच्चा ऐसा क्यों कर रहा है, उसका बच्चा ऐसा कर रहा है. So no, your baby is unique. He is special or she is special in her own way. It is important to understand that no two antenatal histories are the same, no two cases are the same. The treatment of no two conditions are similar. Also, manifestations of same disease conditions also differ from baby to baby. It's not necessary that if your baby had respiratory distress and another baby had respiratory distress, the outcome is going to be similar. So it is very, very important to keep that in mind. So I hope I have covered most aspects of how to care for a premature baby. So it is very important for you to note these things, keep these things in mind, take very good care of your newborn baby, your NICU warrior, as well as of the mother. At the end of the day, these babies thrive if the family environment is good, the maternal environment is the maternal health is good, and raising a preterm baby is a combined cumulative effort of the team of doctors as well as the family. So it's a joint effort, and we ought to do our best. I would be happy to take questions if any. And this is where we end today's session.